One thing that you often don't hear too much about is medical errors. This is a report back from CNBC. This is back from 2018. The third leading cause of death in the United States. Most doctors don't want you to know. And then it goes on to say, it says a recent Johns Hopkins study claims more than 250,000 people in the United States die every year from medical errors. Others report claims the numbers to be as high as 440,000 people. So that's right. According to Johns Hopkins, which I guess is some people view as a very prestigious hospital, makes the claim that US doctors kill more patients than COVID itself every year. And it goes on to say, it says medical errors are the third leading cause of death after things like heart disease and cancer. Advocates are fighting back, pushing for greater legislation for patient safety. And that's why in the hospital you get an ID band, has a medical record number on it. That's why when a nurse walks into your room, they ask you, what's your name? Can you tell me your date of birth? And they match it against the medical ID band. And that's why you see more hospitals move over to electronic medical records, so that when they come into the room, they'll scan your ID, they ask you for your name, they ask you for your date of birth, or if the person can't talk, they're supposed to look at the medical record band, check the name, check the date of birth, check the MRN, and then look over at the computer, and then you cross-check to make sure that it matches. Some places, like where I work, go even as far as to take a picture of the patient, so that when the nurse opens up, or when the doctor opens up the medical record of the individual, they see a picture of the patient, they have the name of the patient, they have the date of birth of the patient, and they have the medical record number of the patient, and then they can make sure that they're talking to the same individual to decrease the risk that is associated to patients. This is typically, especially what we do when it comes to distribution of medications, so that part of the 5 rights is that so the right person gets the right medication at the right time via the right route. And that's why if a doctor writes a prescription, let's say for a particular drug, and it says, by mouth, but the patient has a peg, we have to ask that doctor to change the order so that the order says via peg. Or if the person can't swallow, then the doctor has to change the order to IV, etc., right? Etc., etc., for all these different reasons, for the purpose of course, making sure that patients are not harmed while they're coming to the hospital, basically, to get cured or to be helped for the things that they're coming to the hospital for. This is why when they even do surgery, they mark the leg, they do things like a timeout, they have a nurse involved, so that there's so many different stops, so that basically patients are not harmed. And of course, this is something that currently is not being discussed, that perhaps maybe some of these patients that have died that are COVID related might have died as a result of poor medicine being administered to patients, as many individuals were of course afraid because of the pandemic, because of the hype that was associated with the disease. Many doctors were reluctant to intubate patients because you're literally face to face with the patient. Many were not wanting to do CPR, because when you do CPR on a patient, it causes aerosolization of the virus. And many patients, of course, were not appropriately coded during the pandemic. I have no doubt that that went across the country, especially when it comes to things like intubation, especially in the very beginning, at the very height of the pandemic, where things like PPE was in want. Many hospitals were complaining that we're about to run out of PPE. Even where I worked, we were utilizing the same face shields for months, forget about days. I still have the same face shield that I had from back in May that we still utilize because of the shortage. The same thing with our N95 mask. We were told to utilize our N95 mask for the entire shift. N95 mask is only designed for 8 hours worth of use. Even the little blue masks that many of you maybe wear out in the community are only designed for 4 hours worth of use. And if that mask becomes wet, that mask becomes useless. And so, of course, this is a lot of the information that is quietly left out, that is not discussed even by practitioners in the field themselves. No one ever talks about, well, maybe we screwed up. Maybe we were the ones that were responsible. Maybe I gave the wrong medication. Maybe I missed a diagnosis. Maybe I give the wrong medication. This has happened. I've had patients where, when I worked back in Elmhurst Hospital, I had this Filipino patient, and the patient had a history of heart failure. So the nurses were always careful, making sure that the patient didn't receive too much IV fluid, because the patient, they become edematous, because the heart is not pumping properly, so it can't, basically circulate the blood properly, and then the person builds up with fluid in the extremities. And I was off for the weekend. I came back on Wednesday. I look at the patient. I'm like, what the hell happened? Lo and behold, someone put the patient on 125 mLs of normal saline every hour, and that patient went 24 hours with constant fluid. That patient ended up dying. There was a patient way back where the medication for heparin, which is to prevent blood clots, where the orders expire, and you have to make sure that if your order is expiring, or if you notice that your order expired, to tell the doctor to replace the order for heparin. And we had a patient way back that unfortunately died. The patient got discharged. They were off the sub-Q heparin for several days. Person ended up having a stroke as a result to a blood clot. And then when they look back, because they have to do an investigation, and when they look back, they found out that the order for the heparin fell off, and that the patient, who had a history of stroke, and who had multiple modalities that would cause them to have a stroke, because they were obese, they had a history of high blood pressure, they had a history of diabetes, and that person ended up having a stroke. And of course, none of this is ever brought up in relation to the current pandemic, that perhaps mistakes are being made in the way of treatment. And of course, no one ever speaks about this. But as CNBC and Johns Hopkins has said, that this is the third cause of death in relation to taking care of people like you.